Jaw pain. Ugh, it's the word,
No,
right? It just throws everything off.
yeah, it really does.
You reached out to us because you've been struggling with jaw pain,
Mm.
and you're not just looking for a quick fix, right?
Right.
You really want to get to the bottom of it.
Absolutely.
So we did a deep dive into some research, found a great article about, the causes of jaw pain, what you could do about it.
Okay.
Hopefully some good news today.
Yeah.
And, one of the things that I think we all kind of jump to when we think about jaw pain is TMJ.
Yeah, for sure.
Is that off base?
I mean, it's definitely a common one. It's not off base, but it's not the only thing, right?
Okay.
There's a lot of other things that can cause jaw pain.
So for those of us who, are not dentists, what exactly is TMJ?
So TMJ actually stands for temporomandibular joint. It's the joint that connects your jaw to your skull.
Okay.
It's right in front of your ear.
Oh, okay.
And so if you're having issues with that joint, that can be a cause of jaw pain.
Okay.
It can cause clicking, popping, even like locking of the jaw, things like that.
So if it's not that, what else? What are some of the other big hitters when it comes to what causes jaw pain?
Well, sometimes it's as simple as your teeth. Dental issues are a big one.
Really?
Yeah, so things like a toothache, if it's not treated, that can actually radiate up into your jaw.
Interesting.
Infections, even a misaligned bite can cause you to have some jaw pain.
Oh, wow.
So even if it seems like a small thing, it can really kind of snowball into something bigger.
Wow. It's interesting how these things are all connected that we don't realize. What about teeth grinding? Because I know, especially when I'm stressed, I tend to do that.
Oh, yeah. Bruxism, as it's technically called, is a really common one, and a lot of people don't even realize they're doing it because it happens at night.
Yeah.
But it can put a lot of force on your jaw. Like, did you know it can be up to 250 pounds of force?
No.
It's like, yeah, it's like a small tiger.
That's crazy. No wonder people wake up with sore jaws. Okay, so we've got TMJ, we've got dental issues, we've got the teeth grinding. What else?
Well, the article also mentioned that it's not just the physical stuff, right?
Okay.
There's some other impacts to this.
Okay. It can really impact your life
Yeah.
in ways that I don't think people really even consider.
Yeah, chronic pain, no matter what it is, can really impact your life, and jaw pain is no different. The article talked a lot about this.
And, it's like that old saying, you don't know what you've got till it's gone. And it's so true.
Yeah.
You don't think about, how easy it is to just have a conversation.
Yeah.
Or to, bite into a burger.
Right.
Until you can't.
Exactly.
And then it's like, whoa. One of the things they mentioned was headaches.
Yes.
Which I know a lot of people experience. That could be tied to this, too.
Yeah, absolutely. So jaw pain, especially if it's from TMJ disorders or teeth grinding, can actually trigger these tension headaches. And so, you're going through your day, you're trying to work, you're trying to enjoy time with your family, and you've got this headache that's just hanging over you.
Just throbbing.
Yeah.
Did it say anything about sleep? Because I feel like if you're in pain, it's got to be hard to sleep.
Yeah, and that's the thing, right? It's kind of like this vicious cycle. If you can't sleep because your jaw hurts, you're going to be more stressed. And then you're more likely to clench your jaw or grind your teeth, and it just keeps going.
Oh, that's awful.
And so it's really important to get ahead of this. The article really emphasized that.
So where do we even begin if we want to, fix this or figure out what's going on?
Well, first of all, you want to reach out to your dentist or your doctor.
Okay.
They are really going to be your partners in this.
Yeah.
So you don't want to try to figure this out on your own.
Okay, so dentist first or doctor first?
I would say dentist first.
Okay.
They can kind of take a look and see what's going on.
So they can, actually tell if it's TMJ just from examining you?
A lot of times, yeah. They can feel around for any, popping or clicking.
Interesting.
They can look at your teeth, your bite, all of that. And if it's something more serious, they can always refer you to a specialist.
Okay, so you kind of have, a primary care physician for your mouth?
Exactly.
And then they can refer you to, the specialist if they need to?
Yeah, exactly.
Okay, so say they figure out what it is. What are some of the things that you can do? What are the treatment options?
Well, and that's the thing, too. It's not one size fits all. It
That's all.
really depends on what's causing the pain.
Okay.
And how severe it is and all of that. Sometimes it's as simple as some lifestyle changes. So applying heat or ice. Have you ever tried those relaxation techniques?
Of meditation and stuff.
Yeah, or even just going for a walk in nature. things like that can help relieve some stress, which can help with the jaw clenching and the tooth
Yeah.
grinding.
Because that can be like a side effect of stress.
Exactly. Yeah.
So if you can kind of like calm that down a little bit.
Right. Exactly.
Okay, so those are some things you can do kind of on your own. But what if, like, that's not cutting it? What else can you do?
Then, you'd want to talk to your dentist or your doctor about maybe some over-the-counter pain relievers.
Okay.
Or in some cases, they might even prescribe something stronger, like an anti-inflammatory
Okay.
or a muscle relaxant.
To kind of help
Yeah, to kind of break that
to
cycle.
break the cycle.
Okay.
Okay, what about those mouth guards that you hear about?
Yeah, so those are called oral splints or mouth guards, and they can be really helpful, especially for people who grind their teeth at night. Basically, it just kind of, puts a barrier between your top teeth and your bottom teeth.
Oh,
So
okay.
you're not like grinding on your teeth,
Okay.
which can wear them down.
Interesting.
It can cause jaw pain. So that's a really good option for some people. And then, if it's something like a misaligned bite that's causing your problem,
Right.
your dentist might recommend braces or
Oh,
something like Invisalign.
interesting. So there are a lot of different things that you can do
There are.
depending on what the cause is.
Exactly.
Um, before we wrap up here,
Mhm.
I'm curious about one thing I saw in the article.
Yeah.
It mentioned eating soft foods.
Yeah,
Is that really a thing?
it is. Especially if you're having a flare-up.
Okay.
You don't want to be like gnawing on a big steak.
Right.
You want to give your jaw muscles a rest.
So like what? Soup and stuff like that?
Yeah, soup, smoothies, things like that are
Oh.
easy to eat.
Got it. Got it. Well, this has been so interesting, I have to say.
Yeah.
I think, jaw pain is something that a lot of people deal with. They don't talk about it very often,
Right.
and they don't realize like all of the things that can cause it
Yeah.
and how it can impact their lives.
Right.
Yeah.
Absolutely. And, it's really important for people to know that there is help out there. Like, you don't have to just live with this. If
Yeah.
you're experiencing jaw pain, go talk to your dentist, go talk to your doctor, figure out what's going on and get it treated.
There you go. Knowledge is power.
Yeah.
All right. So for our listener out there who's dealing with jaw pain, we hope this has helped kind of demystify some things for you,
Yes.
giving you some hope
Absolutely.
that you can feel better because you can. And we will see you next time for another deep dive.